Now, I will always review with you what I think is the ideal treatment. Now, there are many ways to skin a cat, and we all have insurance hoping that it will cover our different problems. And so we are going to do our best, as long as we agree with the treatment that they've approved, we are going to do our best to work within those constraints. So I don't want you to feel that your care is going to be sacrificed. Now, there is one aspect, I guess I can still use this, and I will use, well, I'll just use red, that is a pain, but it's the reality. And that's what insurances call conservative therapy. Now, what insurances want to do, as you know, is not spend their money. And so they want to essentially do their best to either postpone treatment, what I call stall. They're hoping that you will switch insurance companies, or you'll get tired of waiting and you'll just give up, or life will intervene, something will happen to your mom, and you won't proceed with treatment. But what several insurance companies do is require you to go through a period of what they call conservative therapy. And basically what their idea is that if you do these measures, they want to see if they can get rid of, or these measures will get rid of your symptoms. Now, what does the conservative therapy involve? Well, the first thing is compression hose. That's probably the most important thing to them. They require you, and it's usually Blue Cross, sometimes Cigna. There are different insurances that require this, but you're supposed to wear these hose and do these measures for 6 to 12 weeks. Now, the compression hose, we measure you for them. We give you the hose. I showed you them before. And I look you in the eye and I say, you have to wear these for the next 6 to 12 weeks. Now, the truth of the matter is, I don't know what you do when you go home. And in my opinion, although most people wouldn't say this, especially on camera, I think very few people will do this. People who have jobs where they stand and they have symptoms will often try them. Some people find them very helpful. You're supposed to wear them in the morning from the minute your feet hit the floor to the minute you get in bed at night. You can try them for 3 months. I'm supposed to be very adamant that you wear them. And again, the idea is that you shouldn't have treatment if these other measures help. Now, besides that, they want you, I'll switch colors here, they want you to exercise. And as I told you, for those of you who are not exercising, walking is wonderful. Again, the idea is if you propel the blood, that your symptoms will be better. Now, a lot of you I know who come to me are big-time exercisers, do classes every day, triathlons, marathons, etc. You just keep doing what you're doing. But for those of you who aren't exercise, I want you to do anyhow. Now, weight. There actually was a study that just came out recently that did show that weight did correlate, excessive weight did correlate with deterioration of veins. Now, there are a whole lot of people who are overweight who don't have varicose veins. So, in my opinion, you've got to have the genetics, and then if you have the extra weight, it puts extra pressure on the veins. Now, the truth of the matter is, we want everybody on at a good weight. It helps everything. It helps your blood pressure, your blood sugar, etc. Makes you feel better, and it will help treatment. So I always encourage people, and I promise I'm not getting any money for endorsing, but Weight Watchers seems to have the best long-term results, so go to Weight Watchers. But if you do this, the exercise and weight loss, if it's an issue that affects you, then do that. Then they want you to avoid hot baths or showers. This one I don't really get. Heat does cause the blood vessels to dilate, and to me, maybe it'll make your symptoms worse at that point, but honestly, once you're up and about, you're back to normal. So I don't know, but I have to say it because that's what they require. You're supposed to elevate your legs. And generally, for most people, that's at night, although truly for those people who have discomfort, they're doing it already. They're putting their legs on an ottoman, lying back in a recliner. There's no question that elevating your legs, and especially if you really have severe symptoms, you want your legs above the heart, above your heart. So you would have your head on one pillow, legs on 3 to 4, or you can lie on your couch, have your head on the armrest and your legs on the back of the couch. That'll help. Now, this is not going to reverse the process, but it may help with symptoms. Now, the last thing is to use medication. I don't know if this is getting too small, but you're supposed to use, by and large, over-the-counter medications. And generally, it's Advil, Tylenol. Again, I'm not getting any kickbacks. Generics, it doesn't matter. Now, the truth of the matter is, most people who have bad enough symptoms will have already tried that. And because of the type of pain, it doesn't work. Now, again, insurance doesn't want me to say that, but I personally have had this issue. Everybody has tried measures like that. If it worked, we'd be taking them. So, but you're required to do this. Now, our staff will look and see, does your insurance require this at all? Is it 6 weeks? Is it 12 weeks? And then we'll let you know what you need to do. Now, a lot of people have already started wearing compression hose. And the key to that, the wonderful thing is if you are prescribed them by another physician, and we have documentation. If you purchase hose, if you can get us documentation, receipt, and it needs to be within the last year for most insurance companies, we can use that when we apply for medical necessity. But that's what they call conservative therapy.